Hi everybody, my name's Andrea. I'm going to give a bit of a background and context for the case study that we're going to discuss this week and do it from a bit of a different perspective. So I hope that this is going to be a good introduction to conceptualize some of the conversations that we'll have in the next few weeks, specifically about the intersections of our physical and our natural systems and the ways that it can interact with our health and well-being. Doing this, I think, start to think about how you build a story and how you build a narrative, and the way that you might do that if you place the story of the land first, and how the story about the land creates the conditions for how we interact with it. So the case study that I suggested this week to start warming us up here is the issue about arsenic in groundwater in Bangladesh. And this is where risks that are related to natural conditions and processes have really been exacerbated by human influence. We, of course, have a lot of examples that are local to us here, and we're going to get into those in the coming weeks as well. So before I go any further, one of the things that we've talked about in the last couple of weeks in the course is determinants of health beyond the social. One of those really important determinants is geography as a determinant of health. And so before we do anything, let's situate ourselves globally and in our geographic context. Where is Bangladesh? And so I know that some of you are very familiar with this and definitely more familiar with this than I am. But thinking about this for our conversations here, I have a map. Our yellow highlighted area, this is the country, or this is the border around the country. We've got the Himalayas here to the north. We've got the Bay of Bengal here to the south, and all of these blue highlights here are some major rivers that flow across the country. So those rivers, the headwaters originate in the Himalayas, and over time they carry sediments from the mountains and deposit them across the Bengal Plain and really the whole of the Indian subcontinent. So what's important is these sediments carry within them trace metals, and these trace metals are really the building blocks for our rocks and mountains. And so breaking them down by wind and by water over time can separate them from a stable structure, and that stable structure might be like a rock or it might be a mountain. And so what happens is as they move and as they travel in the water, you know, rivers and surface water really being the great architects of our landscape, the sediments become buried, and in this case, they're kind of semi-solid. Like they're not as hard as rock, but they're not quite like beach sand. And because of the spaces between all of these particles, they can hold a lot of water, and you can extract a lot of water from them. And so by that definition, you would call these aquifers. And so aquifers like this that are made out of eroded material, that's pretty common. It's not unusual that they would have elevated trace metals in them. And that's because these are naturally occurring minerals. And under the right conditions, they can separate from the structure that they're held into, and they might go into solution. And so, for example, you have all of these sediments that are together. You can consider this like a soil structure. And once you have oxygen that gets entered into the system, or you have water into the system, it destabilizes it. And that's how you get trace metals that might be attached to sand particles. That's how you get trace metals that get kicked off. And that has to do with chemical processes. So I just want to pause there because it's really important to emphasize how natural systems, they work independently and interdependently to create these conditions. So we've got these landforms, we've got the water that flows through them, we've got the soil that's deposited there. We tend to study each of these things very separately and sometimes can lose sight of how much they're connected. So in the same ways that we talk about silos in healthcare, there's silos in environmental science too, and we need to think about the ways that we can connect them. Okay. So this situation alone, having arsenic in groundwater or other contaminants in groundwater, it's not enough to cause people to become unwell. There needs to be a pathway that connects the source to the receptor. Okay, so that's where we'll go from here. So in the context of this case, we can examine the way that the context, so the social, geographic, and historical determinants of health have interacted to create a pathway. So now in Bangladesh in the 1970s, the country was dealing with a social crisis, and it was the aftermath of the Civil War. And there was also a public health crisis. And this was just a vast outbreak of waterborne illnesses like giardia and cholera. And this is from drinking contaminated surface water. So when I'm talking about surface water, that's water on the ground. Groundwater is water in the ground. So one of the international responses to this was that NGOs started traveling to rural areas and they started installing tube wells, which had only been used like minimally up to this point. And so tube wells are a type of water well. They are inexpensive, they're shallow, they're easy to use, and they're really easy to install. So now a water well, think of like a straw that has slots on the bottom of it. And when you push it into the ground in the right spot, those slots allow water from that aquifer to come into the tube and you can pump it out. Now, this was a really great response because doing that, putting that tube in the ground, accessed water that was not connected to any of the microorganisms that were on the surface that were causing giardia, cholera, other waterborne illnesses. Okay, so the urgency of this response, though, either overlooked or didn't test for chemical contaminants, and so subsequently, some of the areas were now exposed to arsenic in water. So again, just because the risk is there doesn't guarantee that the problem is going to occur. So even though we have a source, that's the arsenic in groundwater, and now we have a pathway, and that's the groundwater transport to the well, is that enough and in high enough concentrations to actually cause harm to people? So there's another part here too. There was an adaptation now to a new water source and to a new way of living. So behavioral changes now started to respond to these increased and perceived safe water supplies, and that started to change the landscape too. So there were more crops that were being planted that needed irrigation. That wasn't an option before because there wasn't enough water. There was more livestock. There was rice being planted, and so that's a very water-intensive crop too. So now the water availability was changing the local economy, the landscape, and also the population density. So there's this ripple effect that was happening too. So because not only was the water quality better, the water quantity had increased. So this all sort of sounds like it's, building up to a good news story. But in the 90s, they started testing some of the water and they found that there were localized areas where arsenic was present in concentrations that were like 7 to 10 times higher than drinking water standards. And so in this case, they were measuring them against Bangladeshi drinking water standards, but a lot of times those cascade down from World Health Organization ones. We have those standards as well here in Canada and BC. So as they kept testing, they kept finding more. And about a quarter of the wells, 25% of the wells that were tested were being tested positive for elevated arsenic. A little bit's okay, but when it's too much, that's when it can really cause harm. And so at that point, their response now was to identify hotspots, start responding to the crisis, and that's what's happening now. Okay, so now let's just talk a bit about these health repercussions. Okay. So arsenic poisoning can cause arsenicosis, and that's the illness that develops from chronic arsenic exposure. And this can cause multiple organ pathologies, skin lesions, and skin lesions that kind of might disguise themselves or be perceived to look like leper spots. There's reproductive health concerns. There's effects to cognitive function. Like there's really a lot of things that can go wrong. So the populations who are most affected, of course, are those who experience those poor socioeconomic conditions. But Things like access to good nutrition can exacerbate arsenicosis as well. Diets that are low in protein, those are things that are needed to help. So the biggest hindrance to successful treatment, though, is the lack of access to non-contaminated water. And because there isn't really any treatment for arsenicosis, the best intervention is to stop exposure. There's another big barrier, though, to seeking treatment, and that's stigma. And this is really emphasized by gender. So the risk of being shunned out of your community and ostracized from your community for fear that someone may have contagious symptoms, lack of health literacy around the issues, these can prevent people from seeking interventions for themselves and their families. And so, like the diagram in the notes shows, there can be these cascading effects, with gender being a major determining intersection on disproportionate risk of seeking treatment, even though the risk for acquiring arsenicosis is higher for men. So when we look at different initiatives that have been taken by the government of Bangladesh, these include efforts that want to determine the extent of the exposure. If you just Google arsenic contamination in Bangladesh, you can see how it's been distributed over some of these maps. You've got these real hotspots around the rivers. There's formation of national committees. These are done to help mitigate contamination, intervening with safe water supplies, household treatment devices, public awareness, patient management, developing a national water policy. There's a lot of really big things that have been happening. And these interventions are short-term solutions to manage the situation, but they also require behavioral changes that need citizen uptake. One of the things that I think about, though, when I've been going through this is that it does still require citizens to be very reliant on public service and to have access and not just access to health literacy and to health education, but to take that up in a way that suits their own life. So with all of these different dimensions, if we're talking about environmental justice as it pertains to healthy populations, where does it all fit in? Like, we need to consider geography. We need to consider the history of this country. Bangladesh, even though it had these civil issues during their independence war in the 70s, it was still part of the British colonies and has an imperial legacy. Bangladesh is one of the most populous countries in the world, even though the population distribution is quite variable. Like, there's some of those challenges that present itself there. So how do we prioritize issues when they're also connected? Lastly, just consider, what about capacity building? I haven't read as much about on-the-ground or grassroots efforts that are working to identify community leaders, build capacity, and do some community-based issues or community-based initiatives. So just some takeaways there to just think about how you think a problem like this could really, how you can start to address it in a way that's working with this public health lens, that considers the natural environment, that is very supportive, and can really have some long-term solutions. So thanks, everybody. Thanks. Bye.